Tuberculosis, TB, is one of the leading causes of death worldwide. In India alone, it claims many lives each year. ICMR-National Institute for Research in Tuberculosis, NIRT, has been at the forefront of India's fight against tuberculosis since 1956. Established under the aegis of the Indian Council of Medical Research, ICMR, ICMR-Nirt has been leading the development of cutting-edge facilities for TB research, prevention, and control. ICMR-Nirt wrote history when it established evidence to show that home-based TB treatment was as good as sanatorium-based treatment. It liberated the treatment of TB from high treatment costs and enabled patients to access treatment from home. It also focused on the importance of nutrition in recovery. NIRT is internationally recognized as one of the pioneers of the Directly Observed Treatment Short Course or DOT strategy, which is one of the most cost-effective of all health interventions for TB. Simultaneously, NIRT also demonstrated that the BCG or TB vaccine is effective in children and prevents TB complication and was shifted under the expanded program on immunization for children. The institute has carried out path-breaking clinical trials to improve the management of tuberculosis in India. Situated in the heart of Chennai, NIRT is a WHO collaborating center for TB research. ICMR-Nirt has also expanded high-quality TB services for children and adolescents through satellite centers in Tiruvallur, Madurai, and Vellore. BSL-3 Biorepository at the Tiruvallur Center is the largest data and sample repository in the country. As a supranational reference laboratory, NIRT has conducted over 30 clinical trials and published over 1,000 research articles in leading journals and publications. The 12 departments of NIRT leverage their specific expertise in contributing to TB research. The Bacteriology department has been supporting controlled clinical trials. Clinical Pharmacology department has been actively involved in conducting pharmacokinetic and bioavailability studies of anti-TB and antiretroviral drugs in TB and HIV-TB patients. Social and Behavioral Research Department supports clinical trials conducted in the center as well as focuses on crucial social behavioral studies in TB and HIV. The Clinical Research Division has been implementing a Phase 3 randomized TB preventive vaccine clinical trial of the 2 new TB vaccines. Recently, NIRT was one of the primary agencies implementing the monumental National TB Prevalence Survey in coordination with the other ICMR institutes and state TB cells across India. Completed in 2021, this is the world's largest survey ever conducted and was crucial in determining the true TB burden in the country. Enabling easy and timely diagnosis, the scientists at NIRT have developed an indigenous cost-effective molecular diagnostic kit, TrueNAT, for rapid detection of TB and multi-drug resistant TB. A big challenge in eliminating TB is reducing stigma in the community. Championing this cause, the institute organizes several awareness camps to empower communities to combat TB-related stigma and discrimination. The institute also leads the Government of India's initiative of sub-national certification of progress of districts of India towards TB-free status. NIRT is making the change. Through its 360-degree approach and dedicated work of officials and scientists, the National Institute for Research in Tuberculosis aims to be the leader in tuberculosis research in India and around the world.